COVID-19, flu season, and now monkeypox, we are all hoping and trying to stay healthy this season. And Dr. Rhett Brown, a board-certified family physician at Avance Care, joins us now with more. Thanks so much for being here. You guys were at Charlotte Pride, which I know was very, very exciting for you. How did it feel to be back after 2 years off?
It was wonderful. It was huge. 275,000 people showed up. It was a chance for us to announce our new practice. After practicing in Charlotte for 30 years, I've opened a new practice and a new venture, and to be able to show that off and to see all the warmth and see my patients in person after all this time. But Pride was just full of love, celebration, acceptance, and just after 2 years of shutting down, being able to just be outside, celebrate, have fun. It was joyous.
Right, and I know that that is so important to you personally and within your practice to be such an ally to the community, right?
So, as a gay physician, one of the few gay primary care physicians in Charlotte, and having practiced in Charlotte for 30 years, to be able to be out there and make sure people know that there is a resource, that we know how to care for this population, that you don't have to worry about going somewhere and being judged. My philosophy is I'm to provide support, guidance, and acceptance. I don't want you to leave any part of yourself in the car when you come to see me. Bring all of yourself to the exam room so we can just have a conversation.
Well, another important thing that happened at Charlotte Pride was that 2,000 doses of monkeypox vaccines were distributed to the public. So do you have any suggestions or guidance for people who might be a little bit worried about monkeypox right now? So
monkeypox, a new virus, something else that may be sort of scary to think about. It is a viral condition. It can be transmitted from person to person, usually with direct contact. It has started in the gay community, and it may be considered, again, just a gay disease, but it's clearly not a gay disease. This does not discriminate. It's just person to person, hand to hand, skin to skin contact, or just being in close proximity to someone in a closed environment for several hours, you're still at risk for getting it. So anyone who thinks they may be at risk should be looking for the vaccine.
Right, and like I mentioned earlier in the segment, I mean, we've got COVID, flu season, monkeypox, and just your normal colds floating around. So what are things that people can do to stay healthy right now?
So, yeah, I'm sure you are like me, some vaccine overload. So freaking tired of talking about vaccines, but vaccines save lives. They're our best weapon in preventing death, preventing hospitalization. So even though we're fatigued about talking about vaccines, the conversation needs to continue. So COVID vaccine, boosters, keep staying up to date on your boosters. Flu season is around the corner. We have been incredibly lucky the last 2 years with social distancing, masking, hand washing, that we haven't seen much flu. We don't want to get slack this fall and go back to those bad behaviors. Social distancing, washing your hands will prevent transmission of the flu. But also just stay healthy. Make sure you're getting plenty of sleep. Make sure you're moving every day, preferably outside, eating a healthy diet, practicing mindfulness, centering behavior, and spending time with people that bring joy to your life. All of those habits help keep us healthy and prevent disease.
Well, quickly as we wrap up here, how can people make an appointment with you if they'd like to come in for a visit?
So we're open accepting new patients. We are in Midtown, and just please go to avancecare.com and schedule an appointment with me.
Wonderful. Thanks so much for being here today.
Appreciate it.